Hi, and welcome to this on-demand training on the Health Center's requirements in you. This on-demand training is brought to you by the Health Center Association of Nebraska, also known as HCAN. For more information, please click on the link below. Today, we're going to learn a little bit more about the Community Health Center movement, ensuring compliance with the program requirements in your role at the Health Center, and finally, how to improve operational excellence. Welcome to your Community Health Center. We are so happy that you decided to work for one and join the movement. You're probably wondering what a Community Health Center is, and hopefully this on-demand video can help. Community health centers are entities that were created by Congress over 50 years ago to meet the healthcare needs of the underserved communities and high-risk patients. The goal was to remove traditional barriers to care, including lack of transportation, language barriers, literacy, and other access to care, where people would not have otherwise have access. Community health centers go beyond the walls of medicine to address the causes of chronic and poor health conditions. Essentially, community health centers provide affordable health care for all, regardless of ability to pay. If we take a couple minutes to look at this infographic, your role in a community health center is bigger than you may think. In fact, in 2022, 31.5 million patients received care at a community health center. 1 in 11 individuals are health center patients. Community health centers are the largest and most successful primary care system. Your role in the community health center where you work at really helps to ensure that patients in your community receive care. So what makes community health centers unique? Well, oversight and regulatory compliance for community health centers is provided by the U.S. Department of Health and Human Services, Health Resources and Services Administration, Bureau of Primary Health Care. I know that's a mouthful. So as you continue to work with your community health center, you may hear the acronym for Health Resources and Services Administration, also known as HRSA, or the Bureau of Primary Health Care, known as BIPIC. These acronyms are commonly used to describe the governmental department which provides oversight over community health centers. Through HRSA, community health centers have various program requirements that must be met. These program requirements are found in the Health Center Compliance Manual and the Health Center Site Visit Protocol. For more information on the requirements that community health centers must meet to maintain designation and funding, please visit the link found on the screen below, or please check with your supervisor. Understanding and learning about the HRSA program requirements will help you to complete your job at your health center. In fact, everyone plays a role in maintaining federal designation and funding, so you may be required or asked to help develop protocols and keep documentation. For example, community health centers offer a sliding fee scale for all services provided, and if patients qualify, can access the sliding fee scale. The sliding fee scale is based only on family size and income. So even if a patient has private or public insurance, they could qualify for your community health center's sliding fee scale. If you work at the front desk, your role may be to ask patients when they check into their visit whether they would like to apply for the sliding fee scale and what their family size and income is. Understanding the requirements helps to implement evidence-based practices, enhance services with improved health outcomes. Perhaps your community health center provides access to transportation services or offers the service directly. While this may not be a requirement for other healthcare organizations, it's actually a requirement for your community health center that transportation services are provided. Finally, you may notice that there are so many clinical quality metrics that the healthcare team you work with must track. This is another way to ensure compliance with the requirements. Community health centers are required to track at least 19 clinical quality metrics. If you're unsure of the clinical quality metrics, please check with your supervisor. Focusing on operational excellence means evaluating workflows to provide high quality care efficiently. Your role in the community health center may include sitting on internal committees to work on specific projects to improve quality outcomes or operational projects. For example, maybe you have noticed that your no-show rate for patients is starting to increase and you don't know the reason why. You may be asked to join the Quality Improvement Committee or another internal committee to help understand why the percentage of no-shows is going up, or maybe the reason for established patients that they're not coming back. If you're asked to sit on a committee, please know that this is such a great opportunity to find a solution to a problem. Be open to piloting projects to change workflows. With the example that we just talked about, maybe your health center wants to implement patient appointment reminders through text messages. Be open to trying new things in order to find solutions to problems. For more information on community health centers, please review the following links. For any additional questions, please contact the Health Center Association of Nebraska.